Today, over the next just couple of minutes, I want to go over briefly an overview of range of motion therapy. Range of motion therapy. Basically, for various reasons, people have a restricted or limited range of motion, and this type of therapy seeks to try to increase the range of motion for someone who has been restricted for various reasons, to help them be more comfortable and more able to enjoy their life, have a higher quality of life, and that sort of thing. So range of motion therapy treats musculoskeletal problems that come about from a multitude of reasons. Sometimes there are problems that limit someone's range of motion because of an injury they've sustained directly to the musculoskeletal system. Perhaps it's from a stroke, and so they're having neurological problems with the brain sending the signals, and it's limiting the motion, and so you're trying to increase this. Surgery sometimes introduces some of these restrictions. A disease can have this effect, and there can be people born with limited range of motion, congenital disorders. And so essentially, for whatever reason, and there's a multitude of different reasons, there's been a restriction in the range of motion, and it's affected the bones, or perhaps the ligaments, the tendons, the muscles, or the skin. Whatever is binding up or preventing the full range of motion, or at least restricting the range of motion, range of motion therapy seeks to come in and help increase the range of motion and produce more what we would consider normal ranges of motion for someone's body. And so there are two types then of range of motion therapy. There's both active and passive range of motion therapy. In active range of motion therapy, the person themselves seeks to do various movements and or exercises to increase range of motion in the area affected for whatever reason. So perhaps someone has had a stroke or has recently gone through surgery, and because of that they need to increase the range of motion in a joint or a limb, and the physician will come in and say, we need you twice a day to do this particular motion for this amount of time, or this many sets of exercises to help increase the range of motion and to keep that particular area from perhaps lessening in its range of motion, getting tighter, seizing up, that sort of thing. So in active range of motion therapy, the person themselves with the injury, with the limited range of motion, is called upon to do certain movements that help increase that range of motion. In passive range of motion therapy, the person who has the limitation is then remaining passive, and someone else is brought in then to perform the motion for them. Now, sometimes this is necessary, but it does carry a risk. If someone else is doing the range of motion for them, that person cannot feel the pain, cannot tell whether or not perhaps they're causing more damage by trying to increase the range of motion. And so a great deal of care needs to be taken with passive range of motion therapy. As someone else is manipulating the joint or the limb or whatever, trying to increase the range of motion, they need to be very careful they don't actually re-injure or make things worse. It's necessary sometimes for passive, but active is best in some ways because the person doing the activity knows what they're feeling. Now, the downside of active is that some people won't push themselves to feel pain, and so they won't actually do the exercises to the full, and perhaps they won't do them at all, and therefore they don't get better. So active has certain downsides to it, but the one good thing is that someone won't actually probably cause themselves further damage, whereas in passive, you can help the person improve, but if you're not careful, you might actually cause more harm. All right, so basically range of motion therapy is to help someone who's received some sort of restriction in their motion due to injury, stroke, surgery, disease, or congenital disorders, something affecting their bones, ligaments, tendons, muscles, or skin, and either the person themselves will be called upon to do it or someone else will be brought in to help them. But the whole purpose of this is to increase the range of motion and to grant them more freedom in terms of their movement. Anyway, this has just been a basic overview of this particular type of therapy.